Can ear infections lead to hearing loss and tinnitus? Imagine a tiny infection causing big trouble in your ears. Yes, ear infections can lead to both hearing loss and tinnitus, especially if they involve the middle or inner ear. When an infection occurs, it often causes inflammation and fluid buildup behind the eardrum. This fluid can block sound from traveling properly through the ear, leading to a temporary reduction in hearing. This type of hearing loss is called conductive hearing loss and usually gets better once the infection clears up. However, if ear infections happen repeatedly or become chronic, they can cause more lasting damage. Persistent infections might damage the eardrum or the tiny bones in the middle ear, known as ossicles. Damage to these structures can cause ongoing conductive hearing loss. In some cases, if the infection spreads deeper into the inner ear or damages the auditory nerve, it can cause sensorineural hearing loss. This type of hearing loss is often permanent and requires medical attention. Children are especially vulnerable because their ears are still developing. Recurrent ear infections in childhood can affect language development if not treated properly. Doctors often recommend procedures like inserting ventilation tubes into the eardrum to help drain fluid and reduce infection frequency, which helps protect hearing over time. Tinnitus, or ringing in the ears, can also be linked to ear infections. When the inner ear or auditory nerve is affected, abnormal nerve signals may be sent, creating the perception of ringing, buzzing, or other noises. Sometimes, tinnitus occurs temporarily during or after an infection due to inflammation or fluid buildup. If the damage is more severe, tinnitus can persist even after the infection resolves, especially if the inner ear structures are damaged. Inner ear infections such as labyrinthitis can cause a combination of vertigo, nausea, hearing loss, and tinnitus. Viral infections affecting the ear can also lead to these symptoms. Sometimes, earwax buildup or other middle ear issues related to infections can cause temporary hearing problems and tinnitus as well. Diagnosing ear infections involves a physical exam, including looking at the eardrum and checking for fluid. It's important to distinguish between infections that need antibiotics and other causes of fluid buildup that might not requiring medication. Proper treatment aims to eliminate the infection, prevent complications, and preserve hearing. If hearing loss or tinnitus continues after an infection, consulting an audiologist or ear, nose, and throat specialist is essential for further evaluation and management. In summary, ear infections can indeed cause hearing loss and tinnitus, especially if they are recurrent or involve the inner ear. Early treatment and careful management are key to protecting your hearing health. Always seek professional medical advice for persistent or worsening symptoms to ensure the best care tailored to your needs.